Hello, my name is Dr. Rafai. I am a kidney specialist and I'm going to talk to you about COVID. But this is not a video like every other video. This is a video that can save your life, save your loved one's life, and truly make a difference for you. First, I'm going to start to explain to you what we mean about statistics. If you listen to the news media or to any medical organization that is concerned with societal health, with community health, all what they do is they throw at you a percentage of mortality or percentage of risk of death, which is now with COVID has been proven worldwide in the United States to be about 2%. Well, this percentage and this odd of getting sick and dying from COVID is very misleading. Does not apply to you, just not one single bit. Does not apply to you. And let me tell you why. So the way they calculate the statistics, you had a group of people with suits and ties, computers, paper, books, pads, pens, presentations, and what they do is they sit down and talk and hash it out, and they calculate numbers, and they say, for 100 people that tested positive, we had 2 people died, so the percentage is 2%. And they print a report, nice glossy cover, and they send it through the internet. And that is exactly what is happening. And for them, that is correct. This 2% does not apply to you. It applies to 100 people. So does it mean that if you get sick and your risk that you're going to the ICU and all what you're going to lose is a small toe or a small pinky, which is a 2% of your body? No. If you are a high-risk individual, diabetes, obesity, hypertension, age, immunosuppressive medications, chronic illness, if that is you, your percentage is not 2% because that 2% has been diluted by the young and the healthy and the 18 years old and the asymptomatic carriers. That 2% is not accurate. It is diluted completely. And here is an example. I work in the ICU. I see dialysis ICU patients. I see renal failure patients in the ICU. This is an example that really strayed from my heart. Chris, I know you're gonna watch this video. You posted on my posts about your illness. You had COVID, she had COVID, your father had COVID. Your father's no longer with us. So if we calculate that percentage, it's about 30%. So that 2% does not come any close to what you really lived. Sister, I've called you sister for the past 22 years since I've known you. You had it, your husband had COVID, your soulmate had COVID. He's no longer with us. So your percentage is 50%. And for you, the child of the couple, that both of them had COVID, both of them were in the ICU, both of them are no longer with us, your percentage is 100%. So back to the point that 2% is community percentage. For you, it's either 0% or 100%. And what can we do? I just don't want to confuse you with percentages and give you fear with no solution. I lived in the ICU almost the past 6 months, seeing COVID patients going in, COVID patients going out, kidney failure COVID patients, dialysis COVID patients, respiratory failure COVID patients. So I live this every day, and I can speak to you from what I have seen with my own eyes. The most common risk factor or the most common denominator, or we have seen that in almost every patient, has been obesity and overweight. This time specifically, is so important, and it's literally, and not metaphorically, literally, it's a matter of life and death that you make serious steps to lose weight. If you eat 5 bites for dessert, next week make him 4, the following week make him 3, and until you are eating no dessert anymore so you can start losing weight. If you eat 2 pieces of bread, make them 1. If you eat a whole serving of mashed potato, make it half a mashed potato. If you park close to your work, park so far so you can walk a little bit more. It is very crucial that you try to cut down your calories and try to do anything to move so you can lose weight, so you can literally reduce your risk from having complications of COVID. What I have seen so far, all my videos in the past have been very scientific, but not experience-based. This particular video has been exclusively experience-based because I've seen it every day in my work. The second thing that I want you to do, that I have seen it with my own eyes, is the actual value of vitamin D. Go to your physician, ask for that blood level of vitamin D, and if it's low, take a supplement and get it to a level that is between 50 to 75. You literally reduce your risk of contracting COVID, and you reduce your risk of having a serious, devastating, critical care or hospital COVID. So there is no excuse. You may have excuses or you may have blames on others. These are two simple measures: calorie restriction, vitamin D. If you do those, I can assure you, your risk of COVID and acquiring COVID and COVID complication is going to be reduced tremendously. So I pray that you will hear this with your mind, not with your ears. You will hear it with your mind and have the passion and the determination in your heart to really do it to save your own lives. And if you don't want to do it, I beg you to forward that video and share that video with somebody that may benefit from this, and they may save their own lives and their loved ones' lives, because this is not really a joke. It is not a mild illness. The 2% is a societal percentage. For you, I want that percentage to be 0 for you, because if you don't take care of yourself and you get sick, that percentage may be a lot higher for you, and you may be at a lot higher risk to end up in an intensive care unit. 2 things: caloric restriction and vitamin D. And with this, I hope I have been able to speak straight from here to your heart, straight from here to your mind. I didn't have to go through your ears. And I hope this will make you determined to make a difference for yourself. Stay safe, stay healthy, be happy. Love you all.